Assalamu alaikum. I am Dr. K.M. Julfiakr Hasan, lecturer in Pathology Department, Bashundhara Ad-din Medical College and Hospital. Today I will discuss about the topics of cellular adaptation, which is the most important topics in general pathology. Subtopics of cellular adaptation: atrophy, hypertrophy, hyperplasia and metaplasia. Now we should know the definition of cellular adaptation. It is a physiological or morphological response of the cells towards physiological stress or pathological stimuli in which new but altered steady rate is achieved, perceiving the viability of the cells, modulating the function and thereby escaping injury. We can define it another way. Adaptations are reversible changes in the size, number, phenotype, metabolic activity or functions of the cells in response to changes in their environment. Types of adaptation. Number 1, hypertrophy, hyperplasia, atrophy, metaplasia. Today I will discuss only the hypertrophy and hyperplasia. Atrophy and metaplasia I will discuss in later on. What is hypertrophy? It refers to an increase in the size of the cells that results in an increase in the size of the affected organ. Picture showing the healthy cells and hypertrophied cells, where the cell's size is increases. Types of hypertrophy: physiological hypertrophy and pathologic hypertrophy. Causes of physiologic hypertrophy: exercise, breast in puberty, pregnant uterus, and pathologic hypertrophy is left ventricular hypertrophy in mitral regurgitation, aortic stenosis and systemic hypertension. Pathogenesis is hypertrophy, increase in functional demand and workload, stimulation by hormones or growth factors. This picture showing the mechanism of hypertrophy. How hypertrophy occurs. Now the definition of hyperplasia: an increase in the number of cells in an organ or tissue in response to a stimuli. Picture showing the normal cells and hyperplasia. Here number of the cells is increased. Types of hyperplasia: two types. One is physiologic types and pathologic types. Physiologic types another classified into hormonal and compensatory. Examples of hormonal hyperplasia: number 1, breast at puberty and during pregnancy, proliferation of glandular epithelium of the female breast, uterine muscle during pregnancy. Compensatory hyperplasia example: partial hepatectomy, unilateral nephrectomy. Examples of pathological hyperplasia: endometrial hyperplasia, benign prostatic enlargement, skin warts by human papilloma virus, atypical ductal hyperplasia of breast. Now hyperplasia is the fertile soil for cancerous proliferation. Explanation: hyperplasia is the result of growth factor driven proliferation of mature cells by increased output of new cells from tissue stem cells. Example: endometrial hyperplasia are at increased risk of developing endometrial cancer. In partial hepatectomy, growth factors are produced in the liver that engage receptors on the surviving cells and activate signaling pathway. But if the proliferative capacity of the liver cells is compromised, as in some forms of hepatitis causing cell injury, hepatocytes can instead regenerate from intrahepatic stem cells. Now I can show you hyperplasia versus hypertrophy difference. Hypertrophy defined as increase in the size. In the other hand, increase in the number of cell is called hyperplasia. Types of self-involvement in hypertrophy is permanent cell, labile cell, stable cells. On the other hand, labile cell and stable cells in hyperplasia. Mitosis occurs in hyperplasia but does not occur in hypertrophy. Nature of stimulus: mechanical and hormonal in hypertrophy, and hormonal and growth factor in hyperplasia. Malignant transformation occurs in hyperplasia but does not occur in hypertrophy. Thank you so much for listening to me.